Good afternoon, sir.
Good afternoon.
First of all, on behalf of our college and everyone else, I would like to thank you for helping us conduct this workshop today.
It was my pleasure entirely. Thank you so much.
Thank you so very much, sir. I would like to ask you to give a kind of an overview about exactly what the workshop was about today.
So the workshop was about giving a real life feel to candidates who want to do hernia surgery or want to refine their skills on hernia surgery without taking the actual risk of jeopardizing a life. So we have a humble cadaver with us who will give us the real life feel. The candidates will be comfortable doing the dissections under our guidance so that they will have enough experience and confidence to do these surgeries when they go back to their house. So this cadaver was experimented upon by us a month ago, and this particular cadaver embalming is so real life like that we as an experienced surgeon did not feel the difference between the real life patient and a cadaver. And so the embalming methods are so nice that we said we can replicate this model on a larger scale where people who want to venture into this territory can do with confidence. Otherwise, if the cadaver is not compliant enough, they would not get the feel of operating upon unreal surgery. And then the take-home message would be slightly different than what they're doing right now. So we have about 12 candidates and 6 cadavers. So we tried to maintain a ratio of 2 cadavers, one cadaver having only 2 candidates to operate upon. So there is no crowding and enough justice can be given to the time and to the resources of a surgeon that he wants to invest. If there are more than 2 people on the cadaver, 3 or 4, there could be some people who are left out completely in spite of being very eager to do so. So this we try and maintain this ratio so that maximum utilization of the cadaver as well as of the surgeon who is coming to come will be possible.
So, sir, as you said, the feel of this cadaver is different from the cadavers which are preserved using formalin.
Yes.
What other procedures can be performed on a cadaver which is preserved during soft embalming?
So, concerning our specialty, hernia surgeries were very easily done. I am sure these kind of cadavers are also being utilized for the ENT workshop that we had recently and also for the spine workshops. It would not be a bad idea to venture inside the peritoneum and see if we can conduct courses on colectomies, cholecystectomies, appendectomies, gynec procedures, laparoscopic resection anastomosis using hand-sewn or stapling models, even the high-till procedures. Because if the cadavers are compliant, I mean, we can utilize these procedures also on the same cadaver.
Thank you so very much, sir.
My
we
pleasure.
would definitely like you to conduct a few courses for UG students as well.
Yes.
You are a true guiding light. Thank you.
My pleasure. Thank you so much.
Hello everyone. Today we have with us Dr. Rohit Dandaute sir, who was a delegate in the Laparoscopic Hernia Cadaveric hands-on training workshop at BKL Valavalkar Rural Medical College. Sir, first of all, I would like to know how your experience was and what difference this workshop will make in your career as a surgeon.
See, first of all, 36 years past, I have passed out from MS surgery in BJ Medical Pune. The problem was laparoscopy never existed in the year 1990. It developed after 1992, it started in India, and then after 2000 it increased like anything. Now, as a surgeon, I never knew anything about laparoscopy. In our textbooks, it was a one-line sentence. A laparoscopic cholecystectomy can be done. Laparoscopy, that was one line. Even recent advances didn't mention anything about laparoscopy at that time. Now, down the lane, as a surgeon, I have to continuously upgrade my knowledge and my skills. So in 2000, I went for laparoscopy training, but those were all observerships. I used to go observe them, but hands-on training nobody gave me. We had some hands-on training on pigs, but pig is a different thing and a human being is a different thing. So still we learned about it. Last 25 years I have been doing laparoscopic surgery, but in advanced surgery we got stuck up, especially in case of hernia. Dr. Mandar Gadge and Dr. Nidhi Khandelwal used to come to my place for last 2 years, and I always used to feel so happy the way they used to operate. And then I used to feel that we should go for training. So first I went to Indore for a cadaver training, and then this was the incident which Mandar informed me. It is there here in the cadaveric dissection, and the cadavers are going to be extremely soft and they will be like real life things. I pounced on it and I feel very happy. At the age of 62, I feel I have become young enough to get trained myself in those advances.
In Marathi, they say शिकायचं काही वय नसतं. Sir is a perfect example of that. And secondly, sir, as you said, this was a laparoscopic workshop. So what do you think was the toughest part of the procedure that was conducted today?
Actually, there was nothing called as toughest.
Okay.
Everything was easy in the hands of Mandar.
Hmm.
I've been seeing him for last 2 years. I'm getting trained under him.
Hmm.
And he's quite young to me,
Hmm.
but still age doesn't matter. Guru is Guru.
Yeah.
And he's been the Guru for me in laparoscopic hernia. So he has taught me. So hands-on was the thing. So I attempted one hernia just last week.
Okay.
So I said before every surgical thing or learning, I usually try one surgery on my own. And then I feel what are the drawbacks in that surgery, and then I get rectified them in the dissections. So the problems which I got last week, I converted into an IPOM mesh, which is easier procedure. But the problems I discussed it with cadaver dissection today, and I rectified it. So next time I think I will be able to solve the problems.
Thank you very much, sir, for your participation.
Okay, thanks.
Thank you.
We have with us Dr. Pradeep Saini. Sir, first of all, I would like to ask you, how was your experience today, and what difference do you think it will make in your surgical career, today's work?
Okay, this workshop, this cadaveric workshop, the day I came to know about it, I already knew both the faculties. They are excellent laparoscopic surgeons. So that was the first reason I tried to attend it. After coming here, to be very frank, I was little bit surprised because the infrastructure was very wonderful. I have been to a place in Delhi also, but the amount of infrastructure that you have here and the cadavers were so nice. All the staff, everything was so good and very smooth. And most important point that I felt was that the ratio of the candidates to cadaver, only 2 candidates were there on 1 cadaver, and it was a small group, which is best for teaching. And the difference that it will make to my practice is, I am doing laparoscopic TAPP hernias. Now both my teachers, mentors, they have given good insight into TEPs and ATP and the pre-peritoneal approach. So I am sure to incorporate those, because there was a mental block which they have taken away, and I am sure that I will venture into extraperitoneal approach rather than abdominal approach. So it is another addition to my armamentarium.
Have you participated in any workshop like this before? And if not, or if yes, the bodies which we use today were preserved by using soft embalming, which is developed by one of our professors from the anatomy department. How was it different performing laparoscopic surgery on a body like this than performing it on a body which was preserved using formalin?
Okay, I have attended a cadaveric course, but not laparoscopic. That was at AIMS. It was a thoracic surgery. The cadavers were as routinely they were preserving in formalin. So the first and most glaring difference here was that there was no formalin in the course. So I was more comfortable. After 3 years also, we did not realize that the time has flown away. And the suppleness of the cadaver was the biggest plus point. It was almost, when we put the telescope inside, the tissues were looking almost near to what we see in living. So that was one very big plus point. Thanks to Prashant sir.
Thank you so much, sir, for
Thank you.
joining us today.
Thank you. Thank you. Hare
We
Krishna.
have with us Dr. Varsha Dandavte. Even she is a surgeon. मॅडम, मला तुम्हाला असं विचारायला आवडेल की हा कॉलेज कॅम्पस रुरल एरियामध्ये बेस्ड आहे, म्हणजे पुणे मुंबई सारख्या शहरात बेस्ड नाहीये. त्यामुळे फॅसिलिटीज सगळ्या प्रोव्हाइड करण्यासाठी इन्स्टिट्यूशनला जे त्यांनी भरपूर कष्ट घेतलेत. तर आजचं हे जे आमचं कॅम्पस किंवा आजच्या सगळ्या फॅसिलिटीज याबद्दल तुमचं काय मत आहे, की तुम्हाला हे वर्कशॉप जे घडलंय व्यवस्थित तुम्हाला आवडलंय का?
प्रश्नच नाही काही. कॅम्पस हे खूप छान आहे, आणि हे जे काही कॅडाव्हरिक डिसेक्शनसाठी हर्नियाचं हे ठेवलं होतं कॉन्फरन्स, अतिशय आवडली. आणि त्यासाठी इतकी लोक वेगवेगळ्या डिपार्टमेंटची झटत होती सकाळपासून, ते बघून खूपच समाधान वाटलं. आणि मुख्य म्हणजे ना, एखादी फॅसिलिटी आपल्याला दुसऱ्यांना देण्यासाठी वृत्ती असावी लागते, आणि ती वृत्ती मला तुमच्या संपूर्ण इन्स्टिट्यूटमध्ये अगदी डे 1 पासून दिसते, वरपासून खालपर्यंत. त्यामुळे हे बघितल्यानंतर खूपच समाधान वाटलं. आणि विशेषतः सर्जरीच्या स्टुडंटला जर सगळ्या गोष्टी लाईव्ह नाही मिळाल्या, एक्सपोजर नाही मिळालं, तर पूर्ण करिअरभर त्याला हे सतत शोधत राहावं लागतं की हे मी कुठे शिकेन, हे मी कुठे शिकेन. पण त्याच्याऐवजी जर कॅडॅव्हरिक डिसेक्शन हा जर हे ओपन झाला, ही फॅसिलिटी जर ओपन झाली, तर प्रत्येक हॉस्पिटलच्या खरं तर सर्जरी डिपार्टमेंट आणि अनाटॉमी डिपार्टमेंट यांनी इनिशिएटिव्ह घेऊन हे जर केलं तर ह्याच्या पुढे कित्येक चांगले सर्जन आपण समाजाला देऊ शकू. आणि ही जाणीव इथे मला दिसली. हे अजूनही वाढलं पाहिजे आणि त्यासाठी माझ्या खूप खूप शुभेच्छा.
थँक्यू व्हेरी मच मॅम. सेकंडली मला तुम्हाला विचारायला आवडेल की आता तुम्ही किती वर्ष प्रॅक्टिस करताय ॲज अ सर्जन?
35 वर्ष.
तर 35 वर्षात हे तुम्ही लॅप्रोस्कोपिक कॅडॅव्हरिक वर्कशॉप पहिल्यांदाच
हो, मी
केलंय.
पहिल्यांदाच आहे.
तर आता हे केल्यावरती पेशंट्सवर सर्जरी करताना तुम्हाला काही फरक जाणवेल का किंवा काही फायदा होईल का असं
हो,
वाटतंय?
नक्कीच जाणवेल. कारण कुठलाही प्रयोग म्हणजे कुठलीही सर्जरी जेव्हा आम्ही पुस्तकात वाचून किंवा गुरूंनी शिकवलेली जेव्हा करत असतो तेव्हा एक मनात सतत थोडंसं दडपण तरी असतंच की आपल्या हातनं थोडी जरी चूक झाली तरी त्याचा परिणाम लाईव्ह पेशंटवर होणार आहे. हे आपल्याला जेव्हा कळत असतं तेव्हा थोडेसे 1-2 पावलं आपण मागे येतो कधी कधी. पण हे जेव्हा आपण कॅडॅव्हरिक डिसेक्शन मध्ये करतो तेव्हा विशेषतः अनाटॉमी जास्त क्लिअर होत जाते. पण प्रत्येक वेळा त्या प्रकारचा पेशंट आम्हाला शिकताना मिळेलच असं नाही. लॅप्रोस्कोपिक हर्निया तर आम्ही शिकलेलोच नाही, कारण आमच्या वेळेला लॅप्रोस्कोपीच नव्हती, लिव्ह अपार्ट ॲडव्हान्स लॅप्रोस्कोपी. तर त्यामुळे जेव्हा कॅडॅव्हरिक डिसेक्शन मध्ये ही सगळी प्लेन्स जी फर्स्ट MBBS मध्ये वाचलेली असतात ती जर पुन्हा बघायला मिळाली आणि त्याच्यात जाता आलं, त्याच्यात डिसेक्शन कसं करायचं, कोणतं प्लेन कसं जपायचं, कोणत्या स्ट्रक्चरला कसं हँडल करायचं, हे कॅडॅव्हरिक डिसेक्शनमुळे जास्त कळलं. आणि मला असं वाटतं आणि मी आशावादी आहे की याचा उपयोग आम्हाला नक्कीच लाईव्ह सर्जरीमध्ये होईल.
Thank you so much, ma'am, for joining us.
Thank you.
Thank you.
Now we have with us Dr. Arbaz Momin sir, who was one of the professors who guided our delegates throughout the workshop. Thank you so very much for your contribution and help, sir. I would like to ask you, how exactly will the delegates benefit from today's workshop?
So today we had 12 delegates. They are practicing qualified surgeons, and they have come to learn new techniques. See, medical treatment is changing. There are newer procedures we are going on, and now the world has become very small, because whatever procedures which are being performed internationally, all over, even in India, we are performing those procedures. And these surgeons need to be updated to these newer procedures, and they need to upskill themselves. But while they are doing it, they cannot go and practice on live patient. Okay. So they need to learn these skills somewhere. So we need to have a platform where they can learn it. Cadaver workshop becomes a very important such platform, because the cadaver tissues are real human tissues, and they have the real feel which replicates operating in a live patient, and that becomes very helpful for them while they are learning the procedure. And the best thing over here today was the way the cadaver has been prepared. The cadaver has been prepared by our faculty here, Dr. Prashant Mulia. He has ventured into this specialty, and he has developed these cadavers so well. They are simulating like real life tissues, except for the pulsations or the blood flow. Otherwise, the characteristics are quite real. And when these candidates are doing these procedures here, it is like doing it in a real patient. And that translates directly into, well, when they go back, they would be able to start doing it. It is quite possible that in the first few cases, they might need a mentor around them, but then they would be able to go and perform those procedures.
Like you said just now that they might be mentor. It is always said that a medical student never stops learning. He always has to be in the process of learning. So how was your experience being a mentor today instead of a mentee? How did you feel teaching your fellow surgeons something new perhaps in the academy?
So see, this we bracket ourselves into as a mentor or a mentee. Okay, it's not that way actually. If you see, okay, while we are teaching, we are learning, and we never stop learning. So this mentor-mentee thing is fluid. While we are teaching, we are learning. We are also taking inputs from, like even when we have a conversation, there are a lot of things that we learn from each other. Okay. And while teaching them, what we realize that we have to like our theory, our practice gets revised, we get better insights into it, and we are able to contribute better. That's how it helps us while we are mentoring someone. But at the same time, we are also taking the feedbacks from them, and we are learning ourselves.
One final question, sir. We are all undergraduates, medical students here. Is there any message you would like to give to any of us who aspire to become surgeons one day? Any message?
Yeah. So, see, we all would have our interest and our passion. So what we need to do is that we just keep on following them. At the same time, try to maintain a balance. Okay, try to maintain a balance. Follow your passion, and you would be there. You would be there. It requires perseverance. So one is perseverance, so that you keep on persevering in the passion that you have. The second thing is to continue to keep the fire burning. Okay, so that is another very important thing that you need to have. And resilience, because if you don't have resilience to walk that, it's just like preparing for a marathon. Okay, so you have to have that kind of a preparation. So this is also like this. Without that, which we cannot do that. And in this, another important thing is that you also need to find out who can help you realize those things. So there are associations which help you. There are students associations, and for surgeons also. Now, if you saw today, these surgeons who have come around